All right, so welcome. This is the e-study guide from the FSMTB MBLEX review. So the FSMTB is the one who actually creates and administers the MBLEX. And what we have here is the first page of the pathology section. And I just want to remind you that pathology includes contraindications as well as areas of caution, and then special populations. As far as I can tell, contraindications, areas of caution, and special populations all have significant overlap. And if we look at the study points, the first four, let me see how much I got here. Let me show you my copy instead. Where's the FSMTB? If we look at the study points, which is really handy because it tells us what we need and what we don't need. Like it tells us what we're not going to have to learn for the exam. What we see is that, and this is on your slides, which is in the MBLEX folder that I share with you guys. What we see are called study points. So study points, really important because it's the points that we want to study. And included in the lecture tonight are these four, plus a few from overviews of pathologies. So we start with contraindications, and we're going to work on differentiating between local and systemic, right? And then we're going to identify where certain types of treatment may be contraindicated, or when certain types of treatment may be contraindicated. Recognizing contraindications like fever, acute infections, major contraindications. These are also often the systemic ones, as well as understanding when to refer a client to a healthcare professional. That's usually a doctor. And then we're going to go over some site-specific issues: bruises, fractures, rheumatoid arthritis, open lesions, acute trauma. Acute trauma means like fractures, sprains, and strains, peripheral neuropathy. And then we're also going to cover common musculoskeletal conditions, specifically strains, sprains, and then trigger points. I'm going to give you the key words for each of those. And then understanding various types of pain: acute pain, chronic pain, visceral pain, and somatic pain. Actually, we're only going to do acute and chronic tonight. I didn't get visceral and somatic ready for tonight's lecture, but we'll get those. We'll get those eventually. Okay, so here we go. So contraindications. When you hear contraindication, think do not massage. So contraindication means you should not be massaging the person. And a contraindication in general will do some kind of harm. When you hear contraindication, think massage will harm this person in some way. Or it's possible that some good may be done, but more harm than good will be done. Systemic and local contraindications. So when you hear systemic, think whole system, like the cardiovascular system, the respiratory system, the integumentary or the skin system. You can also just think whole body, right? Because a lot of these systems go head to toe. So it's almost as though the entire body is affected. Although if you break the body down into systems, the 11 distinct body organ systems, then you could make the argument that it's not the whole body, it's just, one or two systems that would be affected through using massage. And that means usually when you see a systemic contraindication, usually it means do not massage at all. You can't work on the person at all, anywhere. Sometimes you can work on the person if a doctor gives you clearance. Sometimes you can't work on them at all. It depends on the nature of the condition. We'll go over some of those. So there's systemic and then there's local. And local means one small area of the body or one area of the body. So you still can do massage for these clients, but you can't do massage on that part of the body for which there is something happening locally. There are some exceptions. For example, with something contagious, if you're absolutely 100% certain that no one else in your facility will get the contagion, then it might be okay to work on that person. For example, if they have athlete's foot, you could have them leave their socks on, and you make sure that you don't touch their feet, and you make sure that you sanitize your table using a ratio of 1 parts bleach to 10 parts water, spraying down the table, wiping it down, letting it dry. Of course, you change all the linens. Also, in general, when there's a contagion, it's a good idea to wipe down the floor, wipe down every single nook and cranny around your face cradle, the hard part included, the adjustable parts, and the part where the table meets the face cradle and back behind it, like underneath, because that's where people breathe, right? So you want to make sure you get as much of that as you can. But there are other things that are contagious enough where you can't, there's no way that you can guarantee that someone else will get it. Like a cold, common cold, a lot of people will go for a massage, a lot of massage therapists will do a massage when the client has the common cold. Yeah, the symptoms are mild, they're not so bad. But if an older person gets the same cold that a younger person gets, they could be in dire condition very quickly. If someone who works with vulnerable populations gets a cold, they may not be able to go to work at all. If someone has, whether they have, I was going to say, if someone has some kind of pre-existing condition like chronic sinusitis and they get minor cold symptoms, it may not be minor to that person. But regardless, if someone gets cold symptoms, it will probably impair their ability to function or to go to work, which interferes with their ability to earn, and that is a major consideration. So it's better just to say, okay, you have cold symptoms, or you have something that looks like a cold, that's contagious, so I'm just not gonna treat you this time. All right. So systemic and local contraindications, there's always some disagreement about some specific things. I'm going to try to help you discern. I'm going to try to help you keep it simple and try to help you discern, which side to lean on, whether to call something local or systemic, whether to say something is totally contraindicated, or maybe it's okay with a doctor's approval. For the most part, I'd like you to keep in mind, I'd like you to try to treat things in this section as though they are black and white, because that's just the best test taking strategy, in my opinion. Just decide for yourself whether something is local or systemic. I'll decide for you. But if you disagree with me, and if you want to, decide the other way, if I say something's local and you think that it's systemic, then, go ahead and have that position, So some of the places where there's disagreement, where you will see disagreeing points of view, either between faculty members or on the internet, is DVT, so deep vein thrombosis. Deep vein thrombosis often looks like the swelling of a leg. It often occurs in the leg, although you can get it in other parts of the body. And often it looks like swelling of the leg, extreme pain or tenderness with the slightest amount of touch around a DVT. And some people say, well, the DVT is in the leg, so that's local. I should be able to work on the person's back, the person's neck, etc. And yeah, that's one perspective. But the DVT, the deep vein thrombosis, it is affecting the circulatory system. So you could make the argument that it's actually systemic. Yeah, maybe it's like a local manifestation, but there is definitely a systemic effect. And the question should always be in your mind, if I work on this person, is it possible I could do harm? And, our imaginations can do a lot. We can imagine a lot that we can go down the rabbit hole, run wild with our imaginations. But if you try to do things a little bit logically, well, if someone has a thrombosis and I increase their blood flow, it is possible that we could dislodge that thrombosis and it could become an embolism, and a traveling blood clot, that's going to end up in the heart or lungs. And that is an emergency or a life-threatening situation. So, you have to weigh things like, could we have a systemic effect? Like, could we do more harm by working on the person's back or the person's neck or shoulders if they have a DVT? I'd say the chances are pretty good that you won't do harm, but it's possible. So always err on the side of caution. And then you would have to decide that is the position you're going to take for the test. That's the perspective you're going to have for the test, that a deep vein thrombosis is actually a systemic and therefore a total contraindication, like no work on somebody with a DVT at all. if the doctor comes in, if the doctor writes a note and says, well, it's okay to work on this person, just not on the leg, then you're covered legally because the doctor says it was okay. The higher knowledge, higher position of authority says it's all right. And I wish this class were the right format to talk about that further, but it isn't. Okay, and then edema. So if someone has swollen ankles or swollen lower legs, or they sometimes get swollen lower legs, they come and go, but their feet are always swollen. Is that local or is it systemic? Well, edema is usually due to the faulty valve structure or the weakening valve structure of the veins. So the veins are the ones that pull blood out of the legs and return it to the heart. Arteries take it away from the heart, veins take the blood towards the heart. And over time, and in some circumstances, like if someone is overweight or if someone has high blood pressure, the structure of the veins can start to break down, as well as the structure of the arteries. And a consequence of that is the pooling of blood and then the pooling of fluid in the lower extremities, because blood has weight and it tends to sink, right? So is it systemic or is it local? Well, it sure looks like local. In fact, in some books, you'll see it referred to as local edema. And what that means is swelling that's visible in like the feet or the legs, but not visible in the face or the arms or the abdomen, for example. But edema should be considered a systemic contraindication. So if someone has edema, you should be thinking, well, their circulatory system is damaged, is compromised. It's not capable of doing what it's supposed to do. In a case like that, where someone has edema, if I were a massage therapist, I would definitely get a doctor's referral first. Just say, go to your primary care physician or your vascular surgeon or whoever the last person was who you saw or whoever your point person is for this, and ask them if it's okay for you to get massage, not on your legs, but on your back, the glutes, your shoulders, your neck, wherever you want to work. And you're kind of really in a hard place if someone with edema comes in and says, I really want you to work on my feet. And that's then questionable. Are you going to do that or are you not? And there's special training out there that you definitely should seek. That'll help you understand when you should and shouldn't work on things like edema. There is edema that happens as a result of cardiovascular decay or cardiovascular disease or breakdown. And then there's edema that happens as the result of the pooling of excess fluids, like in pregnancy. Sometimes people get edema at the end of their lives, and foot and leg massage for someone who is dying can make all the difference in the course of how they feel that day. So if you're interested in working with terminal patients or pregnant people, seek out that extra training. Always think, is it safe for this patient to receive massage? Is it safe for this patient to receive massage? In general, any systemic contraindication, which we'll go over all those in a minute, should be considered a total contraindication. Now, if someone gets a doctor's approval, written doctor's approval, then it's okay for you to work on that person, but you have to read the note and work within the limits of what the doctor has laid out. So the doctor would probably say for a deep vein thrombosis that's in the right leg, it's okay for you to work anywhere on the body except the right leg. And then you don't work on the right side from the groin down, for example, because that's where the leg starts in the hip joint. So you don't work from the hip down. All right. Yeah, when you see systemic, think general, think system-wide, because the entire system is affected. That can be the respiratory system, the skin, the digestive system, but it could potentially be the whole body. Could potentially be the whole body in any kind of so-called systemic or general contraindication, like fever. And you can see in the case of something like fever or a contagious disease, you can see how the word general would be more appropriate than systemic. When they say systemic, I think sometimes they mean a body system, and sometimes they mean the entire body, or sometimes they mean general. So you have to keep that in mind. Systemic in general can be synonymous, or can mean system-wide, one system at a time. So fever, for sure, a systemic contraindication. No massage when somebody has a fever. Why do they have a fever? Do they have something contagious? You don't want them in your clinic. Or perhaps they have a fever and they're so inflamed and their body cannot regulate its temperature. The last thing that you want to do is to have that person disrobe in a room that's 72 degrees and get under a sheet. That person should be at home bundling up or sweating out or whatever they need to do to regulate their own temperature and to be comfortable. And they should be getting whatever kind of medical care they need. Fever is doesn't always require medication, but sometimes it does. And you're going to find also that one thing that people come to us, alternative medicine providers, for are things that they haven't seen doctors for, or maybe don't want to see doctors for, or have no intention of seeing a doctor for. So I've had people come in with fevers, or with local stuff like swollen limbs, swollen knees, and they think, well, I'll get better in a few days from the fever, and it turns out that they have, I asked them to go to a doctor, and it turns out that they have bacterial bronchitis, right? Which is very dangerous because bacteria tend to multiply in the respiratory system in a way that is more rapid than viruses. And oftentimes people head towards or end up with pneumonia with something bacterial, right? But this person was never going to go to a doctor because they just wanted to avoid it. In the case of the person who had a swollen red knee, I've seen this twice. Those were both staph infections. And they could have turned to MRSA, methanicillin-resistant Staphylococcus aureus infection. And, MRSA, it's also called flesh-eating bacteria. So people will often come to massage or to acupuncture in order to get some care as an alternative to Western medicine, an alternative to seeing a doctor. So you have to think that, puts you in the position of having to differentiate. You have to think, well, could I do harm by working on this person? Could I do harm to the system by working on a swollen leg? Could I do harm to a respiratory system by working on someone who has a fever, or to the brain, to the neurological system by working on someone who has a fever? Contagious diseases, almost all contagious diseases, total contraindication, even colds, no matter how mild. 70% of Americans go to work. Well, 70% of workers in America go to work even though they have cold symptoms, which is why so many of us get sick. So many other people get sick. Can be a big deal, as I discussed earlier. Don't do it. Don't treat somebody who has a cold symptom. Yeah, it really sucks to send somebody away who, and then you don't get the money and they don't get to feel a little bit better. Although trust me, when they have a cold, their body's ignoring inflammation and swelling in a way that they're just going to stay achy and uncomfortable. We can't help them that much compared to when their body is normal. But it is for everyone's best. So some examples of contagious diseases include any kind of virus, any kind of bacteria. Maybe you've heard of this thing called COVID or the flu. Also strep throat, or strep infection, which you can have on the skin. TB, tuberculosis. That's, maybe we don't think of TB as something that's that common. But here in New York, if you're going to work with in the public education system, you have to get a TB test before you can go into the schools. So even if it's rare, it is very serious. Shingles or chickenpox, that's a no-go. You got to stay home, buddy. Contagious conjunctivitis. So there's many kinds of conjunctivitis, like pink eye. Some pink eye just comes from dust that you happen to get exposed to that you're not used to. And others are caused by bacteria or viruses. Kidney or liver conditions, kidney or liver failure. So this is one of those things, just keep it simple. Don't go into all the different kinds of kidney conditions. If somebody has a stone, if somebody has nephritis, if someone has kidney failure, just make it a systemic contraindication on the MBLEX. Just make it a systemic contraindication. Don't work on that person. Untreated hypertension, like I said, some people will come because they have no intention of getting their blood pressure worked on or getting their blood pressure regulated through any kind of medication. Perhaps they haven't even sought out any kind of dietary or exercise routine. Hypertension can be completely untreated, and people everywhere, from all walks of life, get high blood pressure, and people in all walks of life choose to ignore it, not to do anything about it. You don't want to be the person who temporarily increases blood flow to some area of the body and has some deleterious effect on the client with, blood pressure that's super high, right? You don't want to do harm to someone. Anyone who's under the influence of drugs or alcohol, that includes any kind of medication like painkillers, and people won't tell you, people, for various reasons, some of them honorable, some of them I can relate to, will not tell you that they're taking medications. They won't tell you that they had a few cocktails before coming in for their appointment, or they won't tell you that they use drugs. However, in every clinic I've ever worked in, whether it's a PT clinic, in every clinic I've ever interned in, whether that's an acupuncture clinic or anything else, that's always like a no-go. Somebody comes in, they smell of alcohol or weed or not that I don't know what that smells like, or anything else, you got to send them away. And it's a delicate situation because you don't want to offend somebody. And you got to decide, you as a business owner, what are you going to do? You're going to charge that person? Let me give you some advice. Talk about it later. Don't talk about it right then. All right. Deep vein thrombosis, local or systemic. Cardiovascular system is affected, not just one leg, not just one area. Plus the risk is system-wide. We talked about that earlier. And then now we're going to go over local contraindications. So we mentioned some of the systemic contraindications. Now we're going to go over some of the local contraindications. Let me just skip ahead and see what else is on here. Yeah, okay. So recall or remember, local means one area compared to the whole system or the whole body, right? It means one area. There are a couple of ways you can think about local contraindications. In my opinion, the best way is just to get really, really familiar with all the different things that you could see locally that are a no-go, and see what they have in common, make the associations in your mind. Don't do very much work over it, but you could say that basically anything that needs you to leave it alone, or that needs to be left alone in order for it to heal, like a burn or a cut, right? You don't mess with those things. You don't fiddle with them. You put whatever topical on there you need, if at all, or maybe some kind of balm, and you cover it and keep it clean, and the body does the rest. And you try to eat well and get a lot of sleep. But there are certain things that it should be obvious to you, like anything where there's open skin, where there's open skin, you don't want to work on that limb at all. If it's on the arm, shoulder, leg, hip, stay away from that entire limb. Stay away from the whole thing. Don't do anything which could open or irritate open skin. Yeah, so that includes obviously cuts, but also scrapes. It includes lesions. So that means like diabetic lesions where the skin is starting to break down and there's a sore. Shingles. Shingles also causes lesions. And at some point, the shingles are extremely contagious and also extremely painful. Although some people don't perceive it as extremely painful, it's just, irritating. Surgical wounds. Remember, if someone has, even if it's arthroscopic surgery and that the size of the wound is like, the tip of your fingernail, still it's a wound. You don't want to open it up. You don't want to mess with it. Stay away from the entire limb. Unless you have some, in that case, well, never mind. Stay away from the entire limb. Local contraindication. Burns. You may not think of burns as the skin being open, but it is. The skin is compromised for sure. The exterior of the body is open. non-healing sores or any kind of necrosis. So sometimes you see necrosis or non-healing sores with autoimmune diseases, poor circulation, because the body can't get the fresh blood and can't get the immune system there to repair. Sometimes you see that with some kinds of cancers and late stage cancer. Non-healing sores, you also see it in terminal patients. You see bed sores, stuff like that. Miserable to have bed sores. Okay, so infections. Here's infections again. That's bacteria and viruses. It's also fungal infections. So tinea, athlete's foot. Maybe somebody has fungus on their skin. You don't have to really be too familiar with that. Clinically, most people know if they have a fungus. If they do, they'll probably tell you if they want an area worked on. But you can also ask, do you have any infections right now? Fungal infections, bacterial, viruses, any parasitic infections? You will see you will see parasites under the skin sometimes. Not often, but you will see it sometimes. Again, ask people. Any kind of damage to the skin that we don't usually think of as open skin or lesions, but like sunburns, frostbite, like a steam burn where the skin just looks, red and or pink or super pink, but it doesn't look necessarily broken. You don't want to be applying anything to that. You don't want to be messing with that at all. Don't touch it, because the immunity in the area is compromised. The body really needs to be regenerating in that area and not interfered with. Okay, other local contraindications that I want you guys to think about are aneurysms. And then these are in no particular order. I'm sorry, I'm not putting these in any order. Let's do like the vascular first. So aneurysms, varicose veins. Don't work on varicose veins. And let's see. Yeah, neuropathy is kind of a close second to vascular problems. Neuropathy can be called a vascular problem in the case where someone has lack of feeling, or the nerves are starting to die basically, or not function correctly because the vascular return in the area is inadequate, and the pressure there is too high, and the nerves can't be maintained. But nothing can be maintained down there, which is why everything, including the skin, breaks down. It's why sometimes people who begin with neuropathy have to have amputations eventually, because the limb or the digit starts to die, and that can come from things like diabetes. It can come from things like smoking, actually. So muscle tears. Now we're getting into trauma. Okay, and there's a couple types of trauma, right? There's the trauma that our nervous system takes on, and there's trauma that the body incurs. So we're talking about physical or body trauma. So that would be things like bruising and fracture. In general, don't work on a bruise. Don't work on a fracture. And then muscle tears. If you try to massage a muscle tear, you're only going to make it worse. You're only going to open the fibers up. Some of these things you don't want to work on the leg at all. Like for a fracture, let's say somebody has a fracture in their femur. I wouldn't work, and the fracture is like right below the hip, right? I wouldn't work anywhere around the knee, for example, the other end of the femur. I wouldn't work on the hamstrings, mainly because I don't want to be putting any kind of pressure on the femur anywhere. And I also wouldn't work on the hip on the fractured side. If someone has, let's say they have a fracture, true story, they have a fracture in their pinky, in that case, it's fine to work on the forearm and the shoulder and the neck and all that, to work on that side. That's okay, but you have to use your discretion clinically. Sorry, I'm veering off. I'm off topic now. I'm into clinical rather than test prep. Muscle tears. Yeah, muscle tears, bruising, and fracture. All right, pregnancy. Let's see. Is a pregnant person a contraindication, or like a person who we could help? Let me think. How about both? Well, if you have the training, if you have prenatal training, you are the person to help pregnant people for sure. If you don't have prenatal training, don't do it. Don't attempt it. Go get the training. Pay the money, spend the time, be a diligent student, learn how to work on pregnant people. Pregnancy is complicated. Every trimester is different. The risks are different each trimester. And maybe your interest is more in helping someone to conceive and to get through the first trimester, which is the most stressful because that's when most miscarriages happen. Or maybe your interest is more in preparing the body for birth and then helping that person maybe during birth. Those are very different skill sets, and they have different cautions and contraindications that we're not going to go over here. But pregnancy generally, like for the MBLEX, it's a contraindication. A local contraindication, yeah, definitely. You wouldn't work on the abdomen or the pelvis. I wouldn't work over the sacrum. Maybe not even anything below the posterior inferior, the posterior superior iliac spine, the PSIS. That means I wouldn't get too far into the glutes. Other people would disagree with me. Some people won't go near a pregnant person. So pregnancy is definitely a local contraindication. And I would say if you don't have the training, clinically speaking, not for the MBLEX, it's a systemic contraindication. Like don't work on somebody if you don't know what you're doing, if you haven't had the training. Undiagnosed lumps or bruises, lumps or bumps. You'll see this all the time on people around joints, especially around the sacrum, the low back. They have these fatty deposits called lipomas. They can be really big. And lipomas, they're harmless. It's not gonna be detrimental for you to work on those. But unfortunately, because we don't see and diagnose lumps and bumps, we can't tell what we're looking at. So ask that person to go see a doctor and have it diagnosed, or ask if they have had it diagnosed. And if it's a lipoma and it's harmless, then you can work anywhere you want, liberally. But if it's undiagnosed, don't work on it. Don't work on the area. Okay, undiagnosed pain. This phrase, undiagnosed pain, isn't that what we treat? Don't we treat people who are having pain who haven't had a diagnosis? Well, you'll learn. But for the purposes of the MBLEX, undiagnosed pain, local contraindication, inflammation, including arthritis. Again, there's a technique to treating inflamed joints. It's clinically something that you want to have in your skill set. I don't know if you guys realize what a big impact you can make on people, how they feel, with things like rheumatoid arthritis or osteoarthritis that's swollen and inflamed because it's overused. But if you work above and below the rheumatoid site, or if you gently flush, it can make a world of difference. Rheumatoid arthritis, again, that goes hand in hand with inflammation. Any questions about the locals or the systemics before we move on? Just call out if you have any questions, okay? So some things that you absolutely have to get a doctor's written approval for. You have to have medical clearance. This is for the MBLEX, right? So on the MBLEX, they're going to ask you, do you send this person away? Do you treat this person anyway? Do you have this person call their doctor? We're going to see, hopefully we're going to get into a couple questions like that tonight when we do the AMTA questions. So cardiovascular conditions, any kind of thrombosis, which is a blood clot, phlebitis. I don't know if you guys know what that is. That's swelling or inflammation, sometimes red, of a blood vessel. It can be visible since a lot of them are close to the skin. You actually can see the redness. It's very painful. Some hypertension. So if someone has high blood pressure, for example, or if they have hypertension in a situation that sounds like it might be dangerous, like there's a syndrome called HELP or HELLP. I forget what it stands for, but it's a condition in later pregnancy, third trimester pregnancy, where elevated liver markers and elevated blood pressure and elevated blood sugar, they all start to conspire, and they can cause different kinds of organ failure, like very quickly in someone who is pregnant. So in a situation like that, or where somebody says, here's an example, somebody says, I just started medication this week for my hypertension, and the doctor warned me that the medication I'm taking has to be calibrated, and we don't know if the dosage is right yet. So my blood pressure may plummet really quickly, unexpectedly, and I may pass out. Right. So that's a case where you definitely want to be in touch with the doctor for sure. And then some heart conditions, if someone has AFib, or if they're taking, or if they have, something that is stable, they're taking beta blockers, they're taking, they have a pacemaker, something of that nature, that's usually okay to work on those people. It's better even to get a medical clearance for that person. But if you're not sure, just get the medical clearance, especially if it's something new or something that seems unstable. So for the purposes of the MBLEX, any cardiovascular condition needs a doctor's referral. Any condition already being treated by a medical practitioner. So, if someone is being seen for low back pain, they got hurt on the job, or maybe they have a disc herniation, those are things that we're capable of treating all the time. And you will get people who are not going to see a doctor, and they'll just be like, I'm not going to a doctor, and that's all there is to it. I haven't seen a doctor for this, and I'm not going to. Maybe they're uninsured, or maybe they're undocumented, or for whatever reason they don't want to go through filing a thing through their work if they're injured on the job, or maybe that's not available to them, so they're not going to do it. So you do the best you can with those people. But for the MBLEX, any condition that's already being treated by a medical practitioner, for sure, you ask that doctor for a referral, especially if the client is asking you for this to treat the same condition that the doctor is treating. Okay, edema. Different kinds of edema, different situations, really needs to be seen by a doctor for assessment, right? It's not necessarily something that you have to have written approval for, but it doesn't matter. Don't split hairs. Keep it simple for the MBLEX. Send them to a doctor. Osteoporosis. Well, how bad is the osteoporosis? I mean, if you think you might cause some kind of fracture, well, it doesn't matter if you think so or not. Someone has osteoporosis, you have to send them to a doctor for assessment and for a doctor's written approval. Cancer, any kind of cancer. Heart problems, that falls under cardiovascular conditions as well, but especially things like angina or people with pacemakers. Again, for the MBLEX, send them to the doctor. Epilepsy, and then diabetes. That's type 1 or type 2 diabetes. Type 1 is the diabetes that people is genetic, diabetes that people have had since they were kids, they're born with. And then type 2 is adult onset. It comes almost entirely from diet and exercise, or lack of exercise. Type 2 diabetes is 100% reversible. Not an MBLEX question. Okay, any questions about conditions that you must have medical clearance for before we move on? So now, overview of pathologies. So the course that I'm teaching through Varsity allows us 10 sessions. That's 20 hours. That's not enough time for us to cover 11 body systems plus all of patho, all of kinesio, and the other 3 or 4 sections of the MBLEX. It's not enough time. So I have to choose the things that I think may have the broadest reach, that may have the most carryover, or that are foundational. So that's what I'm trying to do. So I skipped signs of contagious conditions of the skin and ways to adjust treatment based on skin pathologies, right? I want you guys to research those or look them up. Understand common musculoskeletal conditions and disorders, for example, sprains, strains, and trigger points. And then we're going to get into acute versus chronic pain. So these slides, they have like a lot of words on them, but don't be intimidated. All right, we're going to go through things slowly, one at a time. You'll be able to take them in. So sprains, when you hear sprain, I want you to think of a muscle or a tendon. What's attached to a muscle? A tendon. Wait a minute. Strain. A strain is the tearing of a muscle or a tendon, okay? The reason I put partial here is because a strain is not a partial, is not a complete tear. It's not where you tear a muscle or completely tear a tendon. That's a tear, complete tear. Strain is partial tearing, can be a lot, can be a lot. A lot of fibers can be torn in a strain. However, it's a muscle or a tendon. Differentiate that from a sprain, and that's also partial tearing, but that's partial tearing of a ligament or a joint capsule. A ligament or a joint capsule. I think on the MBLEX, they associate subluxation with sprains, but as long as you understand what a subluxation is, you'll be fine. So sprains often involve subluxations or the subluxation of a bone or a joint. That's where a bone moves out of alignment, but not out of place. It's like a mild dislocation. We do it all the time. It's not actually a dislocation, like a milder dislocation, but not a dislocation. It's a subluxation. You know, when you feel like you really need to crack your knuckles and you traction your knuckles, or when you really need to stretch and your bones crack, you're moving subluxations, you're reducing subluxations, you're moving bones back into place when you do that. Anything within your natural range of motion, cracking that happens, that's actually reducing a subluxation, the result of a subluxation. Okay, the trigger point. When you see the word trigger point on the MBLEX, I want you to think hyper-irritable. Hyper-irritable. I see that word more than once on the AMTA. I haven't taken all the FSMTB practice test. I haven't finished that test, so we'll see if it's there too. I'll bet it is. So a hyper-irritable locus. A locus is a location. Hyper-irritable locus within a taut band of skeletal muscle located in the muscular tissue and or its associated fascia. Hyper-irritable locus within skeletal muscle. I would even just say within a muscle. Like that. Keep it simple. A hyper-irritable locus within skeletal muscle. Trigger points, they can refer pain into other places. So here are some trigger points in various muscles. Trigger points are denoted by the X. This is from the work of Dr. Janet Travell. And you can see, for example, with the splenius capitis muscle, that even though the trigger point is right here around C2, the occiput area, below the occiput area, the place where it refers pain is the vertex of the head. And then this is one of my favorites, the sternocleidomastoid muscle. So the trigger points in the sternocleidomastoid muscle can have referral patterns that go up over the eye into the cheekbone, you know, above the eye. It can look like a specific kind of headache, you know, like a migraine headache or a sinus headache, right? But generally people don't say sinus headache. They know if they have sinus congestion or sinus problems, but you know, trigger points all over the body. Like here's a trigger point. It looks like it's the abdomen and the hip, but it's actually, this trigger point here is actually in the psoas muscle, and this one is in the iliacus muscle. Those can refer pain down around their attachment, where those become the iliopsoas around the hip flexor and down into the thigh. Trigger points around the gluteus minimus or the TFL can refer pain into the IT band or back into the buttock. Glute max trigger or glute min trigger points, I think that's glute min, can refer glute med trigger points can refer pain into the buttock, into the sit bone, as far down as the calf muscle. Trigger points in the back can refer pain down into the glutes. Trigger points in the upper trap can refer pain up over the head to the corner of the eye, to the corner of the jaw. So they have pain referral patterns. They don't just cause pain locally, they can cause pain in other places. And if you find a trigger point, if you press the trigger point, you may recreate the pain referral pattern. You may not also, but of the kinds of things that you're going to encounter, reproducing a pain referral pattern is part of diagnosing a trigger point. All right, let's look at acute pain versus chronic pain. I'm going to tell you guys about visceral and somatic because I don't have a slide for it. Acute pain, let me just read this whole thing down for you, all right? The acute pain happens suddenly. It starts out sharp or intense and serves as a warning sign of disease or threat to the body, like an ankle sprain or a fracture. It's caused by injury, surgery, illness, trauma, or painful medical procedures. Generally lasts from a few minutes to less than 6 months. That's from the International Association for the Study of Pain. If you want to read the whole article, you can click here, and it'll open the link for you. All right, but 6 months, well, that's a matter of opinion. But I kept it in there just because it's the quote. So acute pain happens suddenly. There's usually a discernible cause. You know, you step off the curb and twist your ankle, fall, slip and fall. Like the description says, some kind of surgery. The acute pain may be from something like illness. Acute has more to do with the onset being quick or being sudden, and also being discernible, and the duration being shorter. Chronic pain, the onset can often be slower, gradual, more insidious, like you don't really see the pain coming, and then it develops and increases, and then you become aware of it. It happens that way sometimes with chronic pain. Chronic pain also, it's characterized by its difficult, like recalcitrant or stubborn nature. Oftentimes people have lots of treatments. They tried lots of treatments and it doesn't get rid of the pain. And chronic pain, the hallmark of chronic pain is it has lasted for several months at least. So there's disagreement on this. There are different opinions on what qualifies as chronic pain in terms of duration, but I think that 3 months is the best definition. If someone has had pain for 12 weeks, 3 months, 90 days, on day 91, I'd call that chronic pain. Chronic pain is a long-standing pain that persists beyond the usual recovery period or occurs along with a chronic health condition like arthritis. So chronic pain may be on or off, on and off, like, you know, it comes and goes, flares up and recedes, or it might be continuous, like all the time, with some flare-ups. Some people who have chronic pain, they have it, you know, at a 5 out of 10 or a 2 out of 10. And it goes up to an 8 or 9 or 10 out of 10 with certain foods or certain activities or not enough sleep or stress, or if their inflammatory condition, their autoimmune condition starts to flare up, the pain also flares up. It may affect people to the point that they can't work, they can't eat properly, they can't take part in physical activity, or they cannot enjoy life. There are many causes of chronic pain, such as illness, injury, and even if the patient recovers from illness or injury, oftentimes the pain for chronic pain remains. Some of the ongoing causes include arthritis and cancer, and sometimes there's no illness, there's no injury, no illness. The pain has just started, and it's the medical doctors have not been able to diagnose it. There's often like a neurological and often an inflammatory component. So you see it in people who have neurological conditions sometimes, like multiple sclerosis or nerves that are overactive. This is a phrase that I made up to mean things like that don't have very good diagnoses, that are not clear, that are very general. Like one of them that I hear sometimes is neurological pain. Well, neurological just means relating to the nerves, but people will carry that diagnosis around them forever. Neurological pain. Sometimes there's pain that is looks like a nerve is firing, sharp shooting, electric, and it just happens randomly. A nerve that is firing inappropriately, an overactive nerve. So often neurological in patients who have neurological conditions, sometimes or often in inflammatory conditions, like people who have lupus, people who have other autoimmune conditions, one of which I heard called a connective tissue disorder. Again, that's like neurological pain. Connective tissue disorder doesn't diagnose anything. There's no, diagnosis means gnosis, knowledge. It's not really any knowledge there. It's just, this is the system, the fascia and the muscles, which appears to be affected by this. So often in chronic pain patients, you find a lack of closure around the cause. And because they do not know the cause, they don't know how to stop it or how to change it. So with chronic pain sufferers, you see a lot of frustration, and you see despondency. You sometimes see depression, and it's often worse because those mood problems are often worse because when someone is in pain, they don't sleep very well. Sometimes there may be multiple nights every week where they don't sleep. So if it's affecting sleep to any significant degree, and even just one night for some people of being woken up 2-3 times with pain and having pain through the night, I'm sure it's kind of like having a little bit of noise or a little bit of light in the room, and you never really get into deep sleep. This is according to chronic pain patients. Affects the mood. It worsens things like pain or their experience, their perception, their experience of being in pain. It worsens depression, despondency, anger. It's a really difficult situation, bringing a lot of compassion to someone, being available to them in order to try to help some aspect of their experience is a gift. Even if you're not sure how to cure the person, you don't have to cure somebody to help them. But even if you're not sure how to, even if you feel like you're in over your head, you're dealing with something that you don't know how to deal with, and we all feel like that sometimes. Still, if you have the basic knowledge, or you have as much knowledge as the doctor has, which the patients usually know more about their pain than what the doctors know, because the doctors are literally going, I don't really know. I mean, it's neurological pain. The methotrexate doesn't help. This doesn't help. That doesn't help. I don't know what to tell you. Why don't you try morphine? They're just and medical Western medicine is notorious for trying all kinds of like whacked out, non-researched bullshit. They accuse us of being quacks, but in the 70s and 80s, they used to do this thing, for example, with arthritis patients. They used to inject gold into them because they thought that the gold injections would help to reduce their pain. Anyway, who's off topic? Any questions about anything that we've discussed? All right. You guys remember that in the MBLEX drive, there is, let me do this by name. In the MBLEX drive, which I've shared with all of you guys, there are, hey, where's my FSMT? I was going to say there are 3 PDFs for the FSMTB e-study guide, but how come that's not showing up? My drive, MBLEX, come on. Here we go. FSMTB e-study guide. And if you open the pathology, this is really important. If you open the pathology or the A&P or the kinesiology, you'll see everything you're supposed to study. And I want you guys to make sure that you're going through these, using them regularly to pick things to study. And sometimes they'll tell you things that you don't have to study. That's especially the case in anatomy and physiology. But there's quite a lot of stuff that we're not going to cover in this class. You really need, I think we really need 12 weeks, like 24 sessions, 24 2-hour sessions. And I've told varsity that, but they're not interested, I guess. Anyhow, classes and medication, we should do this one next time, because this is a little bit much for you guys to research on your own. Okay. So it's 9 o'clock. Let's take a break before we start to do our questions, and come back in 10 minutes. So it's 9:01. So come back at 9:11 Eastern time, 9:11 Eastern time. Oh, not that one. There we go. So the way that I've done this, I make sure that every question has all the answers. You see how there's only 3 answers here, 1, 2, and then part of 3. So this one has the question, and then the next slide is the 4 answer choices, and then the next slide is the answer. And in some cases, there's a 5th slide that has, there's an additional slide, because if the answer and explanation are very long, it requires 2 slides. All right, so a high school student comes in for a massage and notes he has recently had a cold. There's a systemic contraindication there, and currently has a body temperature of 101.5 degrees Fahrenheit. So 2 contraindications. However, he has no other symptoms and says he's feeling much better than he felt yesterday. What is most appropriate action for the massage therapist? Has anybody here ever been in high school? Does anybody remember how much common sense we had? Very little. Continue with the massage, but alter the client's physician as to his alert the client's physician as to his condition. Continue with the massage and take precautions to avoid transmission of the illness. Do not continue with the massage immediately. Send the client home. Stop the massage immediately and send the client to urgent care. So what do you guys think?
Cancel the massage.
And send him home or send him to urgent care? You think you should send him home or send him to urgent care?
Say send him home.
Yeah.
Yeah, send him home, I think too.
Do not continue with the massage and send the client home. Let's see. Yeah, there's nothing here that describes why you would not send him to medical care. But, obviously there's nothing that warrants sending him to urgent care, I think. Okay, what is poliomyelitis? Poliomyelitis, a viral infection of the nerves that control skeletal muscles, the inflammation of the meninges, the progressive death of nerve cells, or the rupture of blood vessels. What do you guys say?
It's twitching. I can't read it.
You can't, it's twitching?
Yes.
Does that make it stable?
Yes.
Okay. So which one do you think? A viral infection of the nerves that control skeletal muscles, inflammation of the meninges, progressive death of nerve cells, or the rupture of blood vessels? Okay, have you guys heard of polio?
Yes.
Okay,
Mhm.
what's the main symptom, or what does someone with polio look like? What kind of problem do they have? With the hallmark of polio. A lot of times they can't walk.
Yes.
All right.
So
So that's probably skeletal muscle control.
Oh,
But why don't let's differentiate from some of the others, okay? So polio is a viral infection of the nerves that control skeletal muscle movement. It's also called polio. There's a polio vaccine. Okay, the second one, meningitis, is inflammation of the meninges. And meningitis is often caused by a virus, sometimes a bacteria. You don't need to know that, but it's an infection, right?
yes.
Progressive death of nerve cells. They're calling that Alzheimer's disease. You know, you also could say that that's multiple sclerosis. And then the rupture of blood vessels, that's a stroke. All right. You guys should make a note of the ones that you missed that you want to review later. Okay, like if you don't know any of these, on question number 2 on the pathos slides, this is a good slide for you to review, because you can learn the definition of 4 different conditions from one slide. So that's question number 2.
Well, number 2, I was thinking it was also progression of death of nerve cells. Since
Yeah,
polio stops you from able to walk, I thought it was in your nerves, or could possibly be in your nerves. That's what I was really thinking.
it does. If this answer, if number 1 were not here, number 3 would have been fine.
Okay.
But your test taking strategy is always choose the best answer, the clearest answer, the most complete answer. So this one is more complete because it has a piece of information, the control of skeletal muscles, that number 3 does not have.
Okay. I
Yeah,
got you.
but now you know progressive death of nerve cells could be not just polio, but something like Alzheimer's disease.
Yes.
mhm.
Uh, Number 3, an injury or disorder that causes physical, chemical, or radioactive damage to a person's body is classified as a degeneration, an infection, a trauma, or an autoimmunity. An injury or disorder that causes physical, chemical, or radioactive damage to a person's body.
Autoimmunity, maybe?
Yeah, I'm not sure about this one. Let's
No.
see. Can autoimmunity be an injury or a disorder? No, that's only a disorder.
Mhm.
I'm going to go with trauma or infection, right?
Yeah.
I think degeneration happens as a result of injury or disorder. And I'm going to go with trauma. Yeah. Yeah, trauma. So let's see how they differentiate between these. Again, this one slide, question 3, is a good opportunity to learn the differentiation between a few different things. So an injury that causes physical, chemical, or radioactive damage to a person's body is classified as trauma. Typically, trauma is a result of violent or disruptive action, toxic substances, or psychological injury. That's not a bad definition, I must say. An autoimmune disease occurs when a person's immune system attacks their own healthy tissue. During any kind of degeneration, body tissue is broken down in a pathological way. Infection occurs when pathogenic microorganisms invade the body. Are you guys confused when you hear the words pathogenic microorganisms? That means microbes, viruses, which are viruses, bacteria, or fungi, which cause some kind of disease, pathogenic. Genic meaning the generation of pathology, generation of disease. Question 4, if a person has uneasy feelings that are connected with sympathetic arousal, what psychological state are they experiencing? Schizophrenia, depression, anxiety, or Alzheimer's disease?
Anxiety, I believe.
Yes. How do you know it's anxiety? I'm sorry, let me be more specific, Vincent. What are the keywords in the question that tip you off to anxiety?
Connected with arousal.
Yeah, there you
Means
go. Yeah, arousal. What does arousal mean? Give me one or two examples of arousal, nervous system arousal.
something that scares you or something. That's
Yeah,
how I would say.
yeah. Being on the lookout for fear. Yeah, for sure, for sure. Expecting fear, being vigilant, hypervigilance. Sympathetic, remember sympathetic and parasympathetic. Parasympathetic, like parachute. Parachute is a feeling, parasympathetic, feelings of safety, friendship. Uh, yeah. And then uneasy feelings, right? Uneasy feelings and arousal, anxiety. And then you guys can read the other definitions if you want to, or if you want me to read them, let me know. A client presents with inflammation and redness that is warm to the touch over a 10-inch region that covers the anterior, lateral, and posterior aspects of her lower leg. That's a big region. So go to your lower leg right now, touch your lower leg. That the lower leg is between the knee and the ankle. The upper leg is between the knee and the hip. So this is a 10-inch region that covers the anterior, the lateral, and the posterior aspects of the lower leg. That's big. Of the following options, what is the most likely cause of these symptoms? So you have to know something about each one of these, all right? So you're about to learn something about each one of these. Cellulitis, contusion, cyst, or a furuncle. What do you guys think?
Cyst, maybe.
Okay, all right. Anybody else?
I was thinking of the first one, cellulitis.
Cellulitis, yeah. So when you see itis, think inflammation. It definitely can be more widespread depending on the word that precedes it, the word it's attached to, or it can be more local. So cellulitis is inflammation of the subcutaneous tissues. That's the tissues like below the subcutaneous region. And it presents with redness and swelling, is associated with bacterial infection. It's a regional or a local contraindication, which means the therapist should avoid work on the affected area. The client should be referred to a physician for diagnosis and further treatment. A cyst is a sac filled with benign fluid. So that wouldn't be 10 inches, Dora. That would be much smaller. A furuncle is a pus-filled cavity that forms as the result of an infected hair follicle. A contusion is another word for a bruise. Cellulitis, contusion, cyst, furuncle.
This
Question? Okay, number 6. What is a contra? Are you guys hearing me okay?
Yes.
Yes.
Okay. What is a contraindication? A condition for which massage would be beneficial, a condition for which an approach could be harmful, general relaxation massage for pleasure, a condition in which there is no benefit or harmful indication.
The second one.
Okay, a condition for which an approach could be harmful, all right? That is correct. What? Question? All right. A massage therapist has been seeing a particular client for several years. When the client is diagnosed with impetigo, how should the therapist proceed? So impetigo, do you guys know what that is?
No.
Impetigo is skin level infection. It often comes from just not washing well enough, and then maybe you get a little abrasion on the skin. Can even be an irritated hair follicle, and then the bacteria accumulates and multiplies and starts to break down the skin. And all infections can be dangerous, but that should strike you immediately as a local contraindication. So what should the massage therapist do? Notice the question doesn't say where you're working as the massage therapist, what part of the body, but it doesn't matter. Continue with massage as usual. Ensure the client has seen a physician for this condition. then continue with the massage while avoiding the affected area. Inform the client she cannot have the massage while this condition is present. Ensure the client has seen a physician for this condition and then continue with the massage as usual.
I'm gonna say C, the third one.
This one, inform the client she cannot have a massage while the condition is present. Okay. Anybody else have an opinion?
I would say the second.
Ensure the client has seen a physician for the condition and then continue with the massage while avoiding the area. Okay.
Maybe.
Yeah. What's the difference between 2 and 4? Is this big enough for you to read, Dora?
Mhm.
What's the
Yeah.
difference? What's the difference between 2 and 4?
Well, in the other one is saying in the second or B, it says
Yeah.
that you are gonna avoid the area.
Right.
And then in the last one, it says that you're gonna continue massage as usual.
Yeah, it doesn't say to avoid the area.
Yeah.
So the answer is ensure the client has seen a physician for this condition and then continue with the massage while avoiding the affected area.
Mhm.
So you have to make sure that the client sees a physician because impetigo has to be treated by antibiotics. And you can continue with the massage, but you must avoid the local area, the affected area. Impetigo is highly contagious, and most commonly seen in children. My 14-year-old who thinks he's a like tough kickboxer and has it all figured out, just figured out he can't keep his butt cheek from getting impetigo, and I'm never going to let him forget it. So now he showers after every training session. Ha. While it's important to refer these clients to a physician, continuing with a massage can help to enhance circulation and therefore enhance healing. It also is important to avoid treatment in the area as impetigo is highly communicable. So you don't have these clients disrobed down to exposing the skin. You know, you have them leave if someone has it on their leg or their buttock, have them leave their pants on, just work on the low back and anything above and below, but not on the affected area. Okay. I'm just going to join the meeting here from my phone so I can. So I can maybe see you guys. Oh, there you guys are. You guys are like have all your cameras off. Okay, good. Well, I'm glad I joined. Anyhow, at least I can see myself now. Sometimes I feel like my voice is going out into nowhere, and I can see who's here now. Okay, a client tells a therapist that when she was out for a run last week, she rolled her ankle. She now has pain with walking and swelling in the ankle. What kind of injury is that? Acute or chronic?
Acute.
That's right. How should the massage therapist proceed? Continue with normal massage, not necessary to refer to a physician. Emphasize treatment on the area, refer to a physician. Avoid the area for now, continue with massage elsewhere, refer to a physician. Instruct the patient to go to an urgent care facility.
Number 3.
I would say for the purposes of the MBLEX, this is probably the best. Yeah, avoid the area for now, continue with massage elsewhere, refer to a physician. A client has spina bifida. This is a condition of the spine which develops in utero. Where's in utero? In the uterus while someone is a fetus and has been present since birth. What type of disease is this? Autoimmune, acquired, acute, or congenital? Is it acute?
No,
Is it acquired?
I don't think so.
Like a virus?
No,
No,
Is it autoimmune?
that's what I believe.
maybe.
No. So
Oh.
autoimmune is where your immune system attacks part of your body, right? This was developed in utero and they've had it since birth.
Oh,
Congenital means you got it from genetics.
okay. I gotta write
Yeah.
that down.
Yes. And you can also go back to slide number 9, right? Question 9. What is a hernia? Loss of sensation, little or no muscle tone, muscle pain, a protrusion of a loop of tissue through an abnormal opening or tear in a muscle wall. Which one?
The last one.
Yeah, the last one. Yeah. Massage therapist applies pressure to a specific area of the right upper trapezius. While he does this, the client reports pain with this that radiates along her upper arm. What is the most likely direct origin of these symptoms? Radiculopathy. Yes. Radiculopathy, a pinched nerve, hepatitis, or a trigger point. So radiculopathy is the description of the symptom of the pain radiating along the upper arm. A trigger point causes radiculopathy. Therefore, trigger point is the more complete or the better answer. A pinched nerve and radiculopathy are actually the same. A pinched nerve is like a colloquial term, or the common term. Radiculopathy is the medical term. Oh, also you can have pinched nerves. You can have a pinched nerve or radiculopathy. You can have that through other causes other than a trigger point, like compression at the spine. What is tendonitis? Inflammation of a tendon sheath, inflammation of a tendon, inflammation of a joint, inflammation of a bursa.
I have a tendon.
I think so too. Yeah. Yeah. Let's see. Inflammation of a tendon and the tendon muscle junction. Do they talk about what is the tendon sheath?
Inflammation tendon. No.
Yeah.
What
Inflammation.
tendon?
Yes. Tendon.
Yeah.
Tendon. So the choices are tendon or tendon sheath, right? And I was looking up whether they defined inflammation of a tendon sheath, and they do. That's tenosynovitis. Tenosynovitis. So you definitely should take a look at this one. Number 12. This is like a piece of foundational knowledge, foundational information. Definitely want to be clear on that. And then joint inflammation. The medical term for joint is arthro or arthur, ATHR. So that'd be arthritis. And then inflammation of a bursa, that'd be bursitis. A new client comes to a clinic with a diagnosis of amyotrophic lateral sclerosis. Oh, amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease. Of the following options, which is not appropriate for this client? General constitutional methods, treatment with physician supervision, treatment without physician supervision, adjusting amount of pressure as the disease progresses, which is not appropriate.
Number 3.
Treatment without physician supervision? I think so, yeah, without, yeah. An athlete is running and suddenly steps on an unexpected rock and rolls her ankle, which results in immediate pain. What system does this predominantly activate? The enteric nervous system, the parasympathetic nervous system, the sympathetic nervous system, or the central nervous system? Well, what is this person experiencing?
The 4th one.
The 4th one, central nervous system?
Yes.
I think the first, maybe.
Can't be the enteric, because enteric means the gut.
Oh,
So this is the wiring of the gut. Enteric nervous system is the brain of the gut. It determines, like if you eat on a regular schedule, the enteric nervous system makes your gut active around the same time.
so it's the second, because the third is the, I forgot how you explained it last time, but it can't be the third one, right?
It is the third one.
Oh,
because the client sprains her ankle and has immediate pain. That's very kind of surprising, shocking, right? So that's a sympathetic nervous system response. That's arousal, hyperreactivity, right? Parasympathetic, para like parachute, floating to safety, friendship, digestion, rest. Does that make sense?
Yes.
Sympathetic nervous system, fight or flight. A basketball player recently had a massage with which used coconut. A basketball player recently had a massage and the massage therapist used coconut scented oil. Shortly afterwards, he notices redness, itching, and some blisters on his legs, which he has never experienced before. What is the most likely cause? Contact dermatitis, atopic dermatitis, psoriasis, or urticaria?
A topper.
It's contact. So contact is the result of contact with an irritant. And then atopic is a chronic condition, and the client is likely to have been aware of it prior to the session. Also, he would likely have had more chronic symptoms like crusting, papules, scaly skin, etc. So some crusting and some scarring. Urticaria, which is hives, would present as severe itching and raised red lesions, but not blisters. Psoriasis is a chronic inflammatory condition of the skin and results in scaly plaque on the skin. When working with a client, a massage therapist notices red streaks along one leg. Bad news. The client has also noted pain along this leg recently following a spider bite in the same leg. The therapist continues with treatment as usual while taking care to avoid the involved area. What should the therapist have done differently? The therapist continues treatment as usual while taking care to avoid the involved area. What should the therapist have done differently? And you can see I mistakenly selected the answer before I had a chance to photograph the screen. And the answer is to stop the massage, speak with the client about the dangers of the symptoms, and refer him to a physician. Where the other choices are wear gloves, or instruct the client to call his physician after the session, or use a hypoallergenic laundry detergent to wash the sheets before the session. So let's find out why it's so. Oh, I didn't photograph the explanation. Okay, good. So the reason it's so urgent is that red streaks. What do red streaks mean? Red streaks mean some kind of inflammation in the vasculature, in the blood vessels. And the fact that he's had a spider bite means he probably has some kind of poison, venom, causing the inflammation, and it's traveling. Which of the following is an example of a respiratory infection? Asthma, pneumonia, anemia, or phlebitis? An example of a respiratory infection.
Asthma.
Asthma?
Ammonia?
Oh,
Pneumonia.
infection. Yeah.
Yes, infection, yes. Got to read the whole question. Pneumonia. A therapist client is on a blood clotting medication. As a result, blood clotting thickens the blood. The therapist should perform the massage as usual, always perform a deep tissue massage for this client, provide deep pressure and aggressive techniques to break up tissue restrictions, avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling.
The
Number
last one.
4.
Yes. Why?
Because they're on medicine that can make you, it can make you bruise easier, right?
Yes,
Mhm.
yes. And I'm sorry. I think I misread it, or I think I misspoke. I may have said that it causes blood to clot. That it's a medication for a condition where someone cannot clot, but that's not what this statement means. Blood clotting medication means it thins the blood, makes the blood
Oh.
thinner. So
Oh.
yeah, it would cause bruising. It would cause they bruise much more easily. Avoid methods that cause bruising, including compression, friction, percussion, and skin rolling. Because anticoagulants, anti-clotting, and platelet inhibitors, anti-clotting, they prevent blood clotting. Even minor internal bleeding is dangerous for the client. These medications are typically used to treat strokes, heart disease, embolism, and abnormal or excessive blood clotting. Deep pressure and aggressive techniques are contraindicated for this client. A client has weak bones that are prone to fracture. Which of the following conditions does she most likely have? Thrombosis, osteoporosis, arteriosclerosis, torticollis.
Osteoporosis.
Osteoporosis, right. Yeah, this one also is a good opportunity to learn 4 conditions because there's an explanation here. A regular client comes for their monthly massage. When they arrive, they say, I'm so excited for this. I have the flu and I've had a fever for days. What do you do?
Send them back.
Yeah. Reschedule the session. During an intake assessment, a client complains of a spinning, nausea, and dizzying sensation when he rolls from lying on his left side to his right side. What condition may he have? Parkinson's disease, whiplash, vertigo, or thoracic outlet syndrome?
Thoracic.
Thoracic outlet syndrome is often manifests as pain, weakness, numbness, tingling in the arm, hands. Doesn't usually give a dizzying sensation when they roll from one side to another.
Whiplash. Oh, no. I'm not sure.
Okay. You think it could be Parkinson's or vertigo?
Isn't vertigo, you supposed to be standing up and then you get dizzy, or do you just have to be moving in general?
Can be dizziness in any position,
Oh, okay.
especially
So it
with
could be
movement.
vertigo.
Yeah. Vertigo, condition that involves sensation that the body or environment is spinning or swaying. Whiplash is the result of an acute injury, most often sustained during a car accident. Parkinson's disease causes tremors. Thoracic outlet syndrome is the impingement of the brachial plexus by soft tissue structures. Question 22, fill in the blank. A massage therapist is employed by a doctor. Whenever the doctor assigns the therapist a new client, the 2 colleagues schedule a meeting to discuss the client's health history in advance of the massage. In the course of this discussion, the doctor tells the therapist about the patient's what? Which is the expected outcome of the patient's illness. The expected outcome. Is that the symptoms, diagnosis, prognosis, or syndrome?
Diagnosis.
Well, the expected outcome. Diagnosis or prognosis?
Prognosis.
Prognosis. So dia means across, gnosis means knowledge. So across all the collection, you collect all the information, you go across the field of information, and then going across all that, you develop an understanding and knowing. That's diagnosis. Prognosis, pro means before. So before the disease runs its full course, you know what's going to happen at the end. Prognosis, you know before it happens. Massage therapist is, oh yeah. Diagnosis is when a physician informs the patient of his or her specific illness. Prognosis is knowing the expected outcome of the patient's illness. A massage therapist begins seeing a client who has Parkinson's disease. The client takes regular medication for this condition. Given this, what is a potential effect of massage for this client? They're asking for Parkinson's disease. What are the side effects, usual side effects? Is it the inability to relax, like agitation? Is it dizziness? Is it excessive drowsiness? Or is it bruising? So this one is definitely a good one for you guys to review. Number 23. Medications to correct the chemical imbalance of dopamine in the brain for Parkinson's. For clients taking these types of drugs, massage often causes excessive drowsiness. It's important for a massage therapist to work under a doctor's supervision when treating people with Parkinson's. Chemical imbalance of dopamine. So they're taking a dopamine regulator. Dopamine is not an excitatory or an arousal neurotransmitter. Dopamine is calming, pleasurable, relaxing. Dizziness is a potential side effect of massage for clients taking a variety of medications, including beta blockers, that's for your heart, and antihypertensives, that's for hypertension, high blood pressure. Bruising is especially relevant when working with patients on anticoagulants, blood thinners. Clients using central nervous system medications may have a hard time relaxing. So a central nervous system medication, that's a stimulant, like Adderall. However, this is not a direct result of massage.
Okay, question.
Yes.
It didn't say they took their medicine yet, so would it still be excessive drought? So we just supposed to assume that they took their medicine every single time they come in?
Yes, because it says the client takes regular medication for this condition. So if the question says they have a disease, that's a chronic condition. If they have a disease and they take medication, assume they're taking it regularly.
Okay.
All right.
All right.
Not a bad question. During an ankle assessment, a client states that she is being treated by her physician for high blood pressure. The therapist obtains more information and learns the client is taking daily medication in order to manage her symptoms. What is the best action for the therapist to take? High blood pressure. The client is taking daily medication to manage her symptoms. What's the best action for the therapist to take? The massage therapist should proceed with the massage as usual. The massage therapist should proceed with caution, modifying their techniques if the client reports feeling lightheaded. The massage therapist should refer the client to her physician for further assessment. The massage therapist should proceed with caution and immediately stop if the client reports pain in the extremities.
The second.
Yeah, I think the second. So the massage therapist should proceed with caution, modifying their techniques if the client reports feeling lightheaded. When a person takes daily medication to manage high blood pressure, it's likely they're taking blood thinners. Of course, the therapist should ask for the name of the medication to ascertain whether this is the case. If it is, the massage therapist may increase the effects of the medication, causing lightheadedness. If this happens, the therapist should modify their techniques and potentially stop the massage entirely. The therapist should also be prepared to help the client off the table after the massage in case they experience dizziness. The massage therapist should not proceed with the massage as usual. The presence of blood thinners in the client's system warrants modifications. The client's already under a physician's care and a referral is unnecessary. So you would not refer the client to the physician for assessment because the client has already been assessed by the physician and prescribed medications. The specific condition will not likely cause pain in the client's extremities, although other conditions may have that effect. What substance forms gallstones? Bile, calcium, uric acid, or none of these?
I believe calcium.
It's actually bile.
Oh.
Let's see. Bile, yeah. Which of the following is considered a general contraindication, not a local contraindication? Frostbite, shock, open wound, or undiagnosed lump? General contraindication, not a local. Frostbite?
Not a local.
That is local. You get that?
Yeah, that's local.
Yeah.
So shock.
Shock, most likely. Yeah. Shock. If a client has periods in which he temporarily stops breathing, which respiratory condition does the client most likely have? Is that dyspnea, asthma, bronchitis, or apnea?
Asthma. No. Yeah, I would say asthma.
The answer is apnea. Temporary cessation of breathing. Apnea is the lack of spontaneous breathing and can cause irreversible brain damage. If it continues longer than 3 to 4 minutes, wow. Relatively common for obese individuals and can be present when sleeping. So you know who to watch out for, right?
Oh, so that just means sleep apnea. Okay.
Well, yeah.
Okay.
Which of the, I think the implication is that sleep apnea is a type of apnea. Maybe apnea can occur at other times. Which of the following is a neurologic condition in which a client experiences noise in the ear that may include ringing, buzzing, or clicking? Dystonia, vertigo, tinnitus, or dyskinesia?
Tinnitus.
Yes, tinnitus. Vertigo is a sensation of movement while the person is being still. Dystonia is disordered random tonicity of muscles. Dyskinesia is the impairment of voluntary movement. The impairment of voluntary movement. Fill in the blank. The axilla and the femoral triangle are 2 anatomical areas that contain high concentrations of lymph nodes. To avoid damaging these structures, a massage therapist should exercise great caution when working these areas. or is it the anterior triangle and the posterior triangle, the ulnar notch and the lumbar region, the upper abdomen and forehead? High concentrations of lymph nodes.
Axilla.
The axilla is
The first one.
and the femoral triangle, yeah, definitely. The axilla and the femoral triangle are two anatomical areas that contain high concentrations of lymph nodes. To avoid damaging these structures, a massage therapist should exercise great caution when working in these areas. Lymph nodes are small, round vessels found along the lymph vessels, usually near a joint. The lymphatic system extends throughout the body. However, it's important for a therapist to know which areas contain the highest concentration of lymph nodes in order to avoid injuring the client. Front of the neck, axilla, inguinal fold, inguinal, like where the inguinal ligament is located. Okay. You are working with a client who has neck pain and notice significant tightness in the soft tissue at the base of the skull and the anterior lateral portion of the neck. The client notes to you that she also has recently been having some difficulty with her breathing. What is most likely occurring? Cervical plexus impingement, lumbar plexus impingement, brachial artery compression, carotid artery compression. So what are they really asking here? They're asking you to discern what? Whether the tightness at the base of the skull and the anterior and lateral portion of the neck is due to the cervical plexus, cervical nerves, the lumbar plexus from the lumbar nerves, or the brachial artery or the carotid artery. Okay, the brachial artery is here. Sorry, it's here. The carotid artery is here, right? The lumbar plexus is down in the lumbar area. Cervical plexus is throughout here.
Cervical plexus.
Yeah, I would think so. Yeah. Tightness, neck pain, and significant tightness in the soft tissue. That's the muscles. Can also be lymph nodes. Well, soft tissues is muscles, vasculature, lymph nodes, but you're palpating muscles a lot. Oh, client notes she's also been having difficulty breathing. So difficulty breathing, interesting. Let's see which one. I'm not convinced it's cervical plexus. Oh, and it is. The teacher becomes the student. The upper four cervical nerves from the cervical form the cervical plexus. This group of nerves include the phrenic nerve, which is important in breathing. Aha. Yeah, I'm gonna come back to number 30 for sure. If a female client has had a mastectomy, which organ or tissue has the client had partially or completely removed? Uterus, breast and lymphatic tissue, prostate, or ovary?
Uterus.
Mast.
Oh, okay. Then it's
Uterus would be hyster. So uterus is hysterectomy. Breast is mastectomy. Mastectomy.
I should know that.
Should. You know it when you learn. Upon assessment of a client with multiple sclerosis, the massage therapist notices both pupils are the same size. What should the therapist do? Continue with the session without physician supervision? Continue with the session under physician supervision? Discontinue the session and call the client's physician? Discontinue the session and call 911.
Think call physician? No. Call not. I don't know. It's between call 911 or call physician.
Yeah, I agree. Or maybe even the second one, but
It says continue.
continue.
Yep. Continue under supervision, it says.
Oh.
Continue with the session under physician supervision.
So would that just have to do with like the type of medication they're taking, or?
Let's read the explanation and see.
I thought
So,
they were-
multiple sclerosis is a disease that involves the degeneration of the myelin in the central nervous system. Massage is indicated, that means beneficial, as long as it is performed under physician supervision. Pupil size is not of concern here, since both were equal in size. If the client presents with pupils of two different sizes, this may be a sign of a severe condition. So they say massage is indicated as long as it's performed under physician supervision. So multiple sclerosis, MS, is one of those conditions you always need a referral for. You always need physician referral, physician supervision. So now let's look at, physician supervision is necessary with the diagnosis of MS. If it was found that the pupils were of differing sizes, then the client should be referred to his or her physician. Emergency medical services or an emergency call are not necessary in this case, where someone has pupils of a differing size or pupils of the same size. So now let's differentiate between the questions. So the correct answer is continue with the session under physician supervision. The other choices are continue with the session without physician supervision, discontinue the session and call the client's physician, discontinue the session and call 911. Now this is very tricky. This is very tricky because two of these options are very similar. Which two are very similar?
The one I said and the one that is correct.
Mhm.
The only issue I have
like
The
your
second
style,
and third.
Vincent, because you're like, I'm not going to do more work than I have to here. The one I said and the other one, the one that I didn't.
No, the only issue I have is I'm new, so I'm gonna be coming in new. So what if I'm not working under a physician supervisor? If I don't have a supervisor for a physician supervisor, that's the
Yes.
only issue I have with this test, this quest right here.
Yeah,
This
well,
question.
maybe the client comes in and says, hi, my name's John. I have a prescription here from my physician for massage.
Yes.
You've got the physician, it's just not on site. You've got the supervision, it's just not on site. So what's tricky is that how do you continue the session under physician supervision without talking to the physician to make sure that they have prescribed massage?
Yeah, that's the issue right there.
Yes.
I don't know. So
They would have to have something written, or what that would mean the physician supervision as well. And
Yes, that's right. Something written means physician supervision, or at least I'm assuming it means that the referral and supervision are the same, or the referral is satisfies the supervision need.
oh, but this one says call the client's physician.
Yes, it says
Yeah.
discontinue the session and call the client's physician versus.
so I can verify that they're there or they wrote this. This is what I would like to do in a real world situation.
Yes, but on the MBLEX, I think that they are combining number 3 under number 2. So when they say continue with the session under physician supervision, that includes the process of pausing, of discontinuing and talking to the client's physician. Hey, is it okay? Can I continue? Right. So that's really tricky, but I can see how number 2 is more complete than number 3. That's really tricky. Okay, and there's no other explanation about the options themselves. Okay, one more. A client has fractured his tibia and is currently in a cast. What can the therapist do? Avoid the immobilized area, but apply techniques to other areas like the calf, knee, thigh, hip, and low back. Stop the massage until the client comes out of the cast. Work as close as possible to the fracture site. Completely avoid the lower extremities and focus on the upper extremities only. What do you guys think?
I say
Probably
work
the
as
last
close as
one.
possible.
I'm sorry? Dora?
I would say maybe the last.
Avoid the lower extremities and focus on the upper extremities only?
Well, not really, because if they only fractured one tibia, then why would you avoid the other like
Yeah.
two.
Right, right.
So I guess it would be A, the first.
Yep, that's what I think. Yep, that's the answer. That's the answer. Okay. All right, good work tonight, guys. We're gonna go over medications next time, and then we're gonna get into we have to get into these other sections. And in the meantime, your assignment is to go to the MBLEX drive to look at this pathology e-study guide. You should be looking at all these and look at the study points. Anything that doesn't have a green check mark by it, we didn't cover tonight. We haven't covered in class. So you have to make sure that we cover it. Oh, these don't have the green check marks. I should do something about that. I should replace this with the green ones. Yeah, I'll replace it with the green ones. See, they don't allow us to mark these up. Google doesn't let me mark the PDFs up. Okay, so anything that doesn't have a green check mark by it, you just make sure that you study, right? So for example, if you go to like understand common conditions and disorders of the nervous system, multiple sclerosis, Parkinson's disease, and migraines. Just go to Google and type in multiple sclerosis and read about causes, symptoms, and management. What causes it? What are the symptoms? What's it look like? And how is it treated? Same for Parkinson's and same for migraines, right? And these are just 3 examples of the nervous system. So you could even type in common disorders of the nervous system, and just a list will populate. Read about that list. Yeah, so you guys do the best you can to cycle through the study points. And you know, some of this stuff like the one I just read about common conditions and disorders of the nervous system, we covered some of that stuff in the questions tonight. So that's your first job, is to go through and look at the ones that don't have green check marks by them and start to study those things. And then the other part of your assignment is to go to the MBLEX drive to the patho slides. We only got down to number 33. And there are 100 questions. We did about 60 slides. There's a total of like 200 slides, 212 slides. So there's 100 questions. It won't take you that long to go through all 100. Start practicing with them. You know, write down which ones you miss. Write down the ones that teach you about, you know, 3-4 different disease states or pieces of information, and make that part of your studies. Keep track of what it is you're studying, you know, keep a log. You know, on Friday, I looked at the FSMTB patho study guide, and I looked up medications and common nervous system disorders. You know, and then I did slides 1 through 50 from the patho slides presentation. You know, and then I want to go back and review slides numbers, you know, 5, 8, and 20. So you guys have some way of keeping track of what you've gone through and what you'd like to go through, or what you need to go back through again. And then be sure to go to the MBLEX folder, and every day open up and read your MBLEX basics. MBLEX March 2023 basics. Make sure that you're reviewing your orientation terms, your planes, your joint movements, concentric and eccentric, agonist, antagonist, your cardiovascular terms. Go through your A&P knowledge base. You know, and then if you have time, just keep going down the list, looking at the diagrams of the hearts, going through the order of blood flow around the heart and the major vessels around the heart. Go through the different types of muscles, The cellular structures of muscles, you're gonna have to know that. Right, here it is. Right, the different sizes, the different shapes of muscles, how the muscles are named, their shape, how they move, their size, right, the different kinds of joints. Be sure to like give yourself the kinesthetic practice of moving the joints so that you're saying, okay, this is what a hinge joint feels like. This is what a condyloid joint does. Yeah, be going through this basics all the time. You can select everything and copy it and put it into your own document if you want to. Right, but keep track of everything. Keep a study log and keep track of everything and make sure that you're going through as much as you can. All right. If you have any questions about anything, just text me, because it can be confusing to keep track of stuff. You know, and now that we're using the FSMTB, now we have a guide, so we can actually keep track of things a little bit more clearly. I'm sorry I didn't bring that in earlier, but I'm glad we have it now. All right, so have a good week, a good weekend, and I'll see you on Tuesday.
All right.
Good
You
night.
guys want to come to the class on Saturday and Sunday, you're welcome to.
My house is a chaos on the weekends, but I'll try. Thank you.
All right, have a good week.
Bye.
Bye-bye.